I'm Shannon. I work as a commander at the Ottawa Paramedic Service. Um, I got into paramedicine because I loved the combination of medicine and problem solving and helping people at their most vulnerable. And I think I started, as many people do, wanting to be the best clinician I possibly could be. And then over time, I realized that there were also opportunities to help improve the healthcare system. And so throughout my career, I've moved through roles in training, working in quality improvement and research and leadership.
My name's Matt Cruchet. I'm a commander with the Renfrew Paramedic Service, and my area of responsibility is all the education and training for our service. We do a lot of activity that wouldn't traditionally be considered your typical paramedic clinical space or clinical environment. So we do of course, we do frontline 911 calls. That's bread and butter what we do, but we also do a bunch of other stuff similar to what Shannon and Ottawa was doing. We have paramedics that work in hospitals. We have paramedics that work in urgent care centers. We have paramedics that do community paramedicine, visiting people in people's homes. They run clinics in communal spaces. So we have all this activity going on that really falls outside of what we would traditionally, say is a paramedic, job, which is to, be in an ambulance and bring people to the hospital when they need help.
When I started in my career and when I went through the education program, there was a big focus on emergency response and on the skills and the practical things you needed to do, the technical skills to respond to high acuity patients. And that's not the reality of the practice that we see today. And it's not the reality of, the needs from the healthcare system that are being placed on paramedics. And I think those will always be essential, responding to the high acuity patient and, being very strong in those skills. But now we need a paramedic that has a much more broader education and that understands things like social determinants of health, chronic disease management, palliative care, working within interdisciplinary teams, and providing more longitudinal care or primary care. And, paramedics who are systems thinkers and who understand, the different aspects of our healthcare system. So we can not only help navigate for patients and help direct them throughout it, but we can also help improve it.
The education that I went through was really geared towards making sure that we're hitting off the key life threats. Your scene times are short. Your procedures are on point, and that is all super important. And we need to do the reps to get that down. What happens is when you land in the job, you find out that so much of what you do is not that. And we don't equip people with the skills to do best for their patients when they're not acutely ill. So the training is shifting to hit all these other areas again in the healthcare realm that is outside of paramedicine specifically.
So much of paramedic education and training and even practice, historical practice, has been focused on what do you do with the intention that you are handing this patient off to another provider that's going to actually finish the care. And I think this book gives you a lot more information on, okay, but if you are the provider completing this care and responsible for whatever this current issue is, or not even issue, but health topic is, what is it that you should be doing? What are the diagnostic tests you should be considering ordering? How do you interpret them? What are the different potential treatment pathways? And how do you escalate those pathways over time? Kind of starting with the least invasive and the most probable and troubleshooting if you don't get, the health outcomes or results that you're looking for.
I think this book was adapted from an existing text that the UK paramedics had produced. And it was done specifically in the context of paramedics working in primary care clinics. So this would be patients coming in to see a paramedic in an urgent care or a primary care environment. And that we maintained that theme throughout the book. And it's really geared towards that patient type. And in the book, when you read through it, some of the examples, the context is, the patient came into the clinic and presented with, and that we maintain that because I think that it was really well structured, and it really presented some really foundational clinical approaches to that type of a patient. Whereas on the road, it's a bit different. We have our algorithms that we apply. We have our primary and our secondary survey. And once you get beyond all that, what happens next? And that's really where this book kind of picks it up from. And it is geared towards, the name of the book is, a handbook for working in primary care clinics. And the idea being that you're a paramedic and you're seeing patients in this clinical space. You don't have to get very far outside of that to see how this applies to anything where we're dealing with patients that are not, not going to the hospital because 911, because all the content in it applies equally, whether they're in a clinic or they're in the community. And it's really just an approach from that.
Even if you're not working within a specific community paramedic program, a lot of paramedic care is shifting to things like treat and refer and alternative models of care, which means that that patient is not necessarily being transported to an emergency department. And however you end that patient contact, you are kind of responsible for setting up that care. So even though the book was designed to be within primary care clinics, there is a lot of transferable knowledge, not just for community paramedics, but I think for all paramedics working in today's current healthcare system with what we're expecting paramedics to do.
For me, the key features is that um, there's really good content on different disease processes, different body systems, and it really delves into uh, s- such a much broader scale of what we would normally learn in our entry to practice paramedic education as it currently stands, and gives us a lot more insight into how we can help these patients when they aren't acutely ill, and what we can do for them, and what the normal process that if they went somewhere else into another primary care environment and saw a physician or a nurse practitioner or a nurse or anyone else working in that space, like what is the norms, what are the standards, what are the references that others are using to address the situation with the patient. That's what this book carries forward. So you understand what the expectations are and what the reference standards are for the various areas of practice, whether that be cardiovascular presentation or perhaps a respiratory presentation, or from GU, GI. It covers the whole scope, which is kind of found very insightful from it.
Stay curious. At the moment you graduate, you may feel like your training has come to an end, but your education has really just started. Medicine changes, treatments change, the healthcare system changes, society changes, and our profession is always changing. So really the best paramedics that I have ever worked with have not necessarily been the ones that graduated at the top of their class and graduated knowing the most. It's those that remained curious, continued to ask questions, continued to learn, look for feedback, and we're always trying to kind of evolve and make their care and practice better. So there's a constant innovation that's happening. And I think it makes it one of the most exciting times to be starting a career and becoming a paramedic.
I would echo that very much. And I found focusing my curiosity on the patient's clinical course really served me well. So you have a patient in front of you, try to follow that patient's journey through the system right to the end. And you'll learn so much more if you're able to kind of trace, like, what's the next step? What's the next diagnostic? What are the potential differentials for that? We do that with the patient in front of us, but take it to the next level is like, what happens in the hospital next? What tests are ordered? What are the potential diagnoses? What are the treatments that go along with that? What are the special referrals that come along with that? And dig into that on a case by case basis, and you'll be amazed by how much more rich your thinking and clinical reasoning becomes, just from exposing yourself to beyond what we would typically be in a paramedic environment.